Hello, everybody. In this training, we're going to be going over the HIPAA privacy overview. So what is HIPAA and what is HITECH? So Health Insurance Portability and Accountability Act of 1996, which was then updated through the Health Information Technology for Economic and Clinical Health Act, which is that HITECH Act, or otherwise known as the Act, as part of the American Recovery and Reinvestment Act of 2009, otherwise known as ARA. So HIPAA is the broad federal legislation that includes rules to protect the privacy and confidentiality of patient information. And HIPAA regulates the use and disclosure of what is known as protected health information, which is PHI, which we'll be mentioning a little bit in this training. So who does HIPAA apply to? HIPAA applies to covered entities, including healthcare providers who transmit electronic information associated with a HIPAA-covered transaction. So some examples of these healthcare providers are doctors, clinics, psychologists, dentists, nursing homes, pharmacies, and hospitals, including behavioral health institutions. So identifying patient PHI, so that's any individually identifiable health information created, received, transmitted, or maintained by a healthcare provider in any form or medium. This will include verbal, written, and electronic information. So that's computer, flash drives, cell phones, etc. As also any past, present, or future physical or mental health information combined with demographic information, i.e. identifiers. So HIPAA confidentiality. HIPAA protects all patient PHI, and as employees, we are mandated to keep it confidential from our family members and their family members, as well as staff who do not have a need to know, and anyone who is not authorized to use and or disclose that information. A patient may sign an authorization to allow the use and or disclosure to others, but until they do, we must keep their PHI confidential unless an exception applies. And also on the bottom there, it says, please keep in mind that PHI containing HIV status and or substance abuse or use requires additional signed authorizations by that patient. So our patient has an opportunity to agree or object. So if a faculty directory is used, patients would need to have the opportunity to opt out, meaning that their name would not be included in that directory. Staff should provide the patient an opportunity to agree or object when discussing the patient's PHI in the presence of a patient's family, relatives, or friends. So we want to be very sensitive to our patient and make sure that they only want the people close to them that they trust around them when we are talking about confidential information. And then a patient can agree or object to what details of their PHI should and can be shared with certain supports and staff. So if a patient does not want part of their medical history to be shared, that is confidential. So the use and disclosure of patient PHI. All healthcare providers may use or disclose patient PHI without specific authorization for treatment, payment, healthcare operations, and other applicable exceptions as authorized by law or urgent conditions. So in these next few slides, we're going to be going over those definitions of these 4 bullet points. So the definition of treatment, that is the provision, coordination, management of healthcare and related services for an individual by one or more healthcare providers, including consultation, possible referrals or transfers, discharges, or anything related to continuity of care. This next definition is for payment, and that is any activities of healthcare provider to obtain payment, determine or fulfill responsibilities for coverage and provision of benefits, and furnish or obtain reimbursement for the healthcare delivered to an individual. So this next one is the definition of healthcare operations, which is the quality improvement activities, case management, care coordination, healthcare evaluation, credentialing and accreditation, medical reviews and audits, fraud and abuse, detection and compliance programs, specific insurance activities, business planning, development, management, and administration, and any activities internal to a covered entity. And then we're going into uses and disclosures. So these are not requiring any authorization. So these are the exceptions. And so the first one being public health as authorized by law. So that's reporting outbreaks of infection diseases. So that's measles, the flu, etc. When employed to prevent the spread and or injury to others. Or adverse event reporting to the FDA, exposure to communicable diseases, reports to the Occupational Safety and Health Administrations, or reports to the Health Department. And then other exceptions are things like reporting abuse, neglect, or domestic violence as authorized by law, judicial and administrative proceedings, law enforcement, health oversight, audits, and investigations as a healthcare organization, cadaveric organ or eye tissue donations, or research if waived by the Privacy Board or Institutional Review Board. This next slide is a continued list of the exceptions. So we'll continue with coroners, medical examiners, and funeral directors as needed, as well as government functions or Secret Service, Federal or Colorado Bureau of Investigations or military branches. And then number 10 down there is workers' compensation. 11 would be an exception to sharing information if there's a serious threat to health and safety of persons or public. So we may release a patient's PHI if to prevent or lessen a serious and imminent threat to a particular person or to the public. We also may release to law enforcement to identify or apprehend an escape or violent individual. This next slide is going into patient rights. So patients have the right to confidential communications. They have the right to request access and or copies to their medical records. They have the right to request an amendment to medical record. They have the right to accounting of disclosures made of PHI. They have the right to request a restriction of a medical record. And that last one on there is that they have the right to file a complaint with the HIPAA privacy liaison. This slide is requests for access and or copies. So any patient may request access and or copies of his or her medical records maintained by any organization. The request must be submitted in written form. Patients can use an authorization form to request copies of their medical records. Access can only be denied if the patient is at risk of harm to self or others. And if access or copies are denied, the physician must provide the patient with a reason. So this slide is HIPAA safeguards. If SKSF policy that all employees and contractors protect the confidentiality and privacy of PHI of all individuals under our care by means that ensures that it will not be accidentally released to an outside party, known or unknown. So some examples of safeguards are locking computers while not in use, encrypting emails with client identifiers, transporting PHI in sealed envelopes, labeling files that are within line of sight of others with numbers, letters, etc., and discussing individual cases behind closed doors. And that goes back to that need to know. And minimum necessary, so SKSF employees and contractors may not use, request, or displace any PHI that is more than the minimum necessary to accomplish the specific purpose of the use, request, or disclosure. That need to know rule. So do you have a need to know the information you are requesting access to? The need to know rule states that PHI should only be used or disclosed as necessary to perform your job duties. Before looking at a patient's health information, ask yourself, what information do I need to do my job? So again, just gathering any information that you need specifically to do your job, but not seeking out that extra information that is not necessary. Copying PHI is only authorized. Employees, contractors can copy patient PHI, and do not leave patient PHI unattended on a copy machine or printer for another staff member to see or grab. Only copy what is minimally necessary and only for those with a need to know. And then these are for faxing PHI. So when you are faxing, patient PHI should be scanned or encrypted and sent by email, hand delivered or mailed whenever possible. So fax should really only be used when necessary to fulfill patient care purposes. So again, fax only the minimum necessary. Employees must take reasonable steps to confirm the accuracy of the fax number that the documents are being faxed, and as a reasonable safeguard to protect faxed patient PHI, faxes should have a cover sheet specifically designed for faxing with the following information, which is the information accompanying this cover sheet is strictly confidential. It is intended only for the person listed above. If you receive this information in error, please contact the person whose name is shown above and destroy this document by shredding. You are hereby notified that any disclosure, copy, or further distribution of this document is strictly prohibited. So again, just a quick overview of this slide. When possible, please try to send by encrypted email or deliver by hand or mail. Just those are the safest ways to be delivering PHI when we can. And if all else fails, we fax, but with that cover sheet attached. And then when we're having conversations about PHI, avoid having discussions in public areas such as elevators, lobbies, hallways, and break rooms. That way other people aren't overhearing a conversation about specific client needs. When discussing PHI using a speakerphone, close the door. If a conversation must take place in a public area, speak quietly, and only disclose PHI to those with a need to know, and only the minimum necessary. So just try and keep things as private as possible. This is for disposal of PHI. So PHI should not be discarded in trash cans, unsecured recycle bins, or any other publicly accessible locations. So PHI must be placed in a secured receptacle. Printed copies of PHI must be shredded and documented that it has been destroyed. And PHI on electronic media must be properly disposed of, including hard drives, flash drives, CDs, diskettes, audio tapes, and videotapes. When working off-site, employees and contractors should take care when transporting PHI. So whether that be putting them in folders where you can't see clients' names and information, as well as putting in a safe bag. When in remote offices or workspaces, must comply with all applicable policy and procedures regarding security and privacy. And you must take extra care that unauthorized individuals or family members do not have access to that patient PHI. So if that means keeping PHI locked up in a home office and away from family members. When transporting PHI, use of confidential and secure carrier or a bag or container where the PHI is not visible and can be contained. So like I mentioned in that last slide, whether that be in a folder or bag, as long as that client's name is not visible. PHI should never be left unattended in an unlocked vehicle. And when transporting PHI and paperwork, make sure that it is in a folder where others cannot see it. When in office, we want to make sure that everything is secure as well. So maintain a clean desk. PHI should not be left on desktops or countertops where unauthorized individuals can see it or have access to it. And then as referred to before, make sure you're locking or log off your computer or workstation when you are going to be away for more than 5 to 10 minutes. Never save PHI on your hard drive. And then that last one down there is position your monitor so those that walk by cannot see your screen. This one is the use of electronic PHI. So ePHI is defined as the same information as PHI, but it is in electronic format. So HIPAA security rules apply only to ePHI stored, maintained, or transmitted in electronic format, including emails, computers, tablets, flash drives, CDs, smartphones, etc. All devices should be password protected and locked when not in use. Portable devices should be encrypted. And then loss or theft must be reported to your HHS and the guardian immediately. So administrative safeguards is ensuring that access to ePHI is on a need-to-know basis only. It's also only access the minimum necessary. You must provide training to staff. You must apply appropriate sanctions to those staff members that violate policy and procedure, as well as you must perform a periodic assessment on how well policy and procedures meet the requirements of the rule. So some examples of these physical safeguards are an organization needs to physically secure PHI, which includes limiting physical access of your home and workspace. If you have PHI on your computer, make sure you lock it when you leave your workspace. And then computer monitors are positioned so that other individuals in your home cannot view patient PHI on the screen. Some technical safeguards are only authorized individuals may view and or have access to systems storing ePHI, proper email and internet usage, which is email sent with patient PHI must be, you can request an encrypted link from HHS or nurse. Links are good for 2 weeks and then a new one is needed. No PHI should appear in the subject line. Use email appropriately. and take caution when addressing email. So with that, just make sure putting initials for the patient instead of their full name, and then as well as making sure that you're sending an encrypted email with their information. And then password management, make sure you're using a strong password, including a mix of upper and lowercase letters, as well as numbers and symbols. You and your password, protect it, never share it. So make sure that you're the only one that knows it and it's not written down anywhere where someone else can find it and use it. So keep it private, out of sight, if you do write it down, and then lock your computer and your workstation when you're not going to be in the area for more than 10 minutes, and press Control-Alt-Delete and then click on lock to lock that computer. So again, just making sure that we have as much security as possible so nobody else has access to that client information. So this is continued for technical safeguards. So this is workstation security. So when you're at your workstation, never save PHI to the hard drive. Save it to an appropriate and secured location on your network. And ensure that your monitor is positioned so that unauthorized individuals cannot see the PH you may be working with. Staff should not use their computers to access, review, or use their personal or family PHI. So malware and phishing. Do not open suspicious emails or click on links from suspicious emails. Report any suspicious emails immediately to your direct supervisor, IT manager, and/or executive leadership. And do not visit sites that are not business related. Some unauthorized sites may automatically download a virus to your computer. So all of that is just to avoid viruses and theft of that information. So secure telecommuting and remote access. So PHI accessed or transported off-site needs supervisor approval. If staff needs to access their work drives from a remote location, they need to take care that SKSF and client data is kept confidential and secure. And then use encrypted storage drives to transport ePHI. Flash drives are approved for staff use. And then ensure that family members and/or friends are not able to access any PHI. Some simple guidelines to follow. Don't betray your patient's trust. That's the big thing. So places such as coffee shops, airports, and hotels offer free Wi-Fi services. These are not secure services and should not be utilized for the purpose of accessing PHI. Never publicly make comments about the care of a specific individual, including online. Acknowledging the care of an individual is an unacceptable disclosure of PHI. As an SKSF employee, we need to protect PHI as long as the organization's reputation as a professional provider of care. Remember, using and disclosing PHI can be a federal offense. Penalties include significant fines and/or arrest. The Office of Civil Rights will investigate and implement penalties. So this is PHI when using social media. So when using social media sites, employees may not reference or post any PHI or personally identifiable information, which is PII, or any proprietary information about SKSF. Social media sites are available to the public, and you should not assume that any posts are private. Friends can copy and print your posts and make them available in public spaces. Even if you have deleted posts, copies may still exist. Your friends may be individuals we care for or their family members. Employees should be mindful of blurring their personal and professional lives when accessing social media sites. Do not duplicate work user IDs and passwords on social media sites. Your professional reputation is reflected in your social media postings, both in your current position and in any future employment you may seek. And if you have questions, please send us an email and we will be happy to answer any questions you have. Other than that, that is the HIPAA overview. And I hope you all have a great day.